Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're trying to get your practice to the $1 million mark, and it's been going well. It's been really fun. I wanted to give you an update. I've been doing my first $1 million. I call it a mini course. I'm not exactly sure what it's going to be called in the future. I don't think it's going to be too mini because it's taken forever. But it's just been really fun to have this camaraderie with people. The way it's working right now is we're having a WhatsApp group where, I don't know if you're familiar with WhatsApp. If you're not, you can download it, WhatsApp.com or something like that. It's owned by Facebook. But what I like about it, once again, I like it because I don't use Facebook. I like it because there is a way to kind of hook it up to my computer via one of those little QR code things, and then I can kind of look at it between patients, and it's a little bit less distracting, or it's the distraction that I'm used to using. But I have I think there's 5 doctors in there. There's some that are a little bit more established. There's some that are just starting out. And the goal there is to get to $1 million in producing in your profit. So what that really relates to, if you break it down, it's producing $80,000 a month in your practice for one doctor, and kind of that breaks down to how much you have to produce each day and things like that. It's working well. We're talking about different aspects of how different people practice, kind of why we practice different ways, how we produce, and the main focus is really trying to get your per visit value to around $200. The way I kind of keep it simple is if you see 20 patients a day and if they're $200 per visit, then you'll be able to make it. And we do something. The best thing I think is that each day we post what we do. So for example, I saw 22 patients yesterday. What my most valuable patients are, which for me it's usually shockwave and orthotics and whatever the other doctors think are the most valuable patients for them. They will post those ones there, and then they also post what they're like the 2 things. So basically tracking a couple of things every day. I like to track how many orthotics and how many shockwaves I do. That's the main 2 things I track, because I like to do 2 pairs of orthotics a day, and then if I can do shockwave, that's always a bonus. And then I also have them keep their mind on what's the most valuable, the MVP, the most valuable patient of the day, because I think it's good to, if we're focusing on trying to produce $1 million practice, you have to kind of keep your eye on the prize. And so what we focus on, we see more of. And so then I'll put on kind of what type of a patient it was, why it was that, how, you don't put you can put how much it produces, but usually it's just kind of what's the most valuable one for your office. So for me, a lot of times it might be a patient that's setting up 3 sessions of EPAD, or someone that's going to do maybe a night splint and some other things due to heel pain. Anyway, that's how it's going. If you're interested more, go to podiatrypracticemastery.com. There'll probably be a section as I open it up again for another group. I'm starting with a small group, and I'd like to do some other groups in the future. If you're interested, let me know. Today I want to talk a little bit about how you put money in someone's pocket and then start it on fire. What this means, I got this idea from Dan Kennedy. He's a marketing person. He says what you do with your practice or with your offers is you want to kind of make it almost too good to be true. And so almost like you put someone's money, put money in someone's pocket and then start it on fire. Meaning, it's the example I'm going to use today is one of the best examples that I've seen for a while. And once again, I am not paid by this company yet. Maybe I will be in the future, but I am not paid. I just like good marketing. And there are 2 companies that are doing this right now. I'm going to speak to one because I only heard of the other one. But the whole idea is we're in a society now that's on a kind of a subscription or disposable type of economy. And what that means is things wear out. If you think of, you have your Keurig pods, and so you have to buy new pods. If you think of, any other, you got your shavers, they're sending you new razors with Harry's every month. They even have this for underwear. They have this thing for everything, where they just things wear out, and then you have to do the disposable. So, what I admire and I'm secretly am a little upset with is Swift. So it's kind of tongue in cheek. I admire it because I think it's a great business model, great business model. So let me explain the idea. Is that they have a disposable on the Swift machine. So the Swift works, really well, quicker, better, all these other things. I'll talk about that later. But what I want to talk about is their business method. Is that every time you use the Swift, you pay a certain amount of dollars for these tips, and the tips hook into the machine, and then it's good for like 15 minutes. So maybe if you bring in back-to-back patients, you can use it on 2 patients, but normally you're using it for 1 patient. Okay, and so each time you do it, you charge whatever it might be. You charge $250 for the procedure. And then you charge $65 for the tip, or you just add the tip into the procedure. That's kind of what we do. Okay, that's fine. But the cool thing is, because they have, certainly they get paid whatever it is for the machine, but the cool thing is they got all this additional recurrent revenue for Swift that they can then use for different things. So they have a couple of things that they offer. So one of the cool things is that if you do AdWords, Google AdWords, they will match your AdWords 50-50. So they have all this kind of this money sitting around if you're actually using their device, and they're going to guarantee that you're going to use the device if you do AdWords. And so it's kind of a no-brainer. Let's say you do 10 patients a month, okay? At $65, that's $650. So you could theoretically do, let's say you did a $500 a month in AdWords, or let's say $1,000, right? So you would pay $500, they would pay $500, and you would increase the amount of Swift that you would do in your office. So really the sky is the limit as long as you have room for these patients. You could saturate the market with how many ads you do, but I think it is a great idea because you're taking something that they're giving you almost your money back. So if you're not going to do AdWords, you're kind of, this money is sitting in your pocket and it's on fire. Does that make sense? So it's on fire. They got all this money from you, and you might as well use the stuff to put AdWords out because it's going to bring in more patients to your practice. So I like that approach. They have a couple of other things, like if you record a patient's testimonial video or like a 1-minute YouTube short, they'll give you $200 or tip credits. So what they do is they do tip credits. That's how they avoid doing some things without like money transaction, almost like a bartering system. So I think that is a great idea. Kudos to Swift. Once again, I am not paid by them. I just think it's a neat idea. While we're here, I'm going to share a couple of other ideas. So we've been using Swift for maybe a couple weeks, 2-3 weeks, 4 weeks, something like that. So it's still new. And I reached out, just a food for thought for you guys. I reached out to our dermatological pathology company. So we use Quantum. We used to use Baco, but we use Quantum now. And I said, hey, we got this new thing for warts. When it works better, my mainstay is the following. Okay, so I have a laser, I have Cantharidin that I use, and sometimes I excise them. I'd say it takes between 3 and 6 sessions, maybe up to 10 sessions for treatment. So the way I explain it, if you're interested, is I say Swift it's about 50% faster, and it's about 85% successful. So it speeds up your healing by 50%. It's 85% success rate, and it has a less than 1% recurrence rate. This is very similar to the thing that I use for Shockwave. So Shockwave, I use, people like this wording, okay? So I say Shockwave, it's about 82% effective. It speeds up the healing by 50%. That's what I say with Shockwave. So I say the same thing. This is about 85% effective, speeds up the healing by 50%, and it less than 1% recurrence rate. So those words really help people decide that they want to pay the money for the Swift, and really it just gets things better faster. So those are kind of the words that I use. I'd like to know what you guys use, or what's working for you in terms of your marketing. And so as I think about this, kind of how, if you've been listening any time, this is how my mind works. I'm trying to think of a way, and I haven't figured it out yet, but like the thought in my mind is, can I offer, let's say, a mastermind, which would be like a coaching program, right? and let's say it's $5,000 a year. I'm thinking $5,000 a year for people. But then, based on that $5,000, if I could have some type of a benefit to the patients, almost like this payback, like Google AdWords for people, kind of put money back in their pocket. The thought is like, let's say you can do $5,000 or whatever it is, and half of that I'll reinvest, with the other doctor, 50-50 in their AdWords to help their practice better, or something. I don't know, $5,000. I don't know how much it would be, but I thought that was kind of a neat idea. It would make it win-win for doing this kind of a mastermind or $1 million masterminder course. Anyway, those are the ideas for today. I'm going to put another one together. I think it'll be more in a video, but I want to show you like all this stuff. I have a whole bunch of a Google folder on all this stuff for Swift. So if you want all my stuff for Swift, I'm going to kind of put it in this big folder. It's all kind of organized somewhat. So if you're just getting started, or if you're using it, you want to see some other ideas, I'll put it there, but it's not there yet because I haven't made the video. Okay, till next time. Thanks.